Welcome back to MedTech's Empire State Biomed Regional Focus as we're spending some time today talking about life science assets, resources, innovators in Westchester County and the Hudson Valley. For those of you who were able to join us earlier, you heard a kind of 10,000 foot view of the region, followed by a conversation that we had with some life science leaders in the region. We now turn to really kind of the exciting piece of the day where we get to spend some time talking with some innovators and entrepreneurs who are operating and growing life sciences businesses in the Hudson Valley. I'm pleased to be joined now by Eric Feinstein, who is the CEO of Clarapath. Eric, it's nice to have you with us. Thanks for joining us today.
Thank you, Wen. I appreciate the opportunity to talk a little bit about what we're doing here.
So let's start, Eric, if you don't mind, on kind of the place that we often start these conversations, and that is help us understand the problem that you identified that became Clarapath.
Yeah, the story actually starts about 6 years ago, while I was working at one of the largest healthcare systems in the country, and largest healthcare system in New York, Northwell Health. Um, Working through the innovation arm of Northwell, came across a entrepreneur and a company, which was Clarapath at the time, and a spinout from Cold Spring Harbor Laboratories. And this business was really focused on applying some of the research from a professor at Cold Spring Harbor, Dr. Partha Mitra, and his academic work, and applying it really to the clinical realm at Northwell. So in the pathology laboratory, a specimen is taken from a patient, call it a mole or any other biopsy. It then goes down to the laboratory to be processed, and during that processing phase, there is a whole series of steps that occur that most people don't know about, and those steps are very technical in nature, uh, and they're performed by someone called a histotechnologist. Uh, those steps really haven't changed in about 100 years, and that really isn't an exaggeration. It's a little frightening to say. One step in particular is, and actually I'll back up. The biopsy comes into the lab. It gets processed. Think of this. I hate to do this, but I may ruin someone's food later today. But I usually like to use that analogy with baking because it's very similar. Uh, the biopsy comes in. It has to be dehydrated and preserved in sort of the current state. And it goes through a series of alcohols, formaldehydes, et cetera, to preserve the tissue. It then moves on to the next phase, where that piece of tissue is embedded in wax, paraffin wax. Think of a wick in a candle, where the wick is the piece of tissue, and the wax around it provides structure to the wick and holds it in place. It's the exact same thing with a biopsy. And so that piece of tissue is embedded in a block of paraffin wax. Uh, it then moves on to the next phase, which is called sectioning or microtomy. And during that phase, it is like going to the deli counter, where you take a piece of salami, which is sort of the biopsy, and we shave these cross sections of that piece of salami. That's effectively what we're doing with the biopsy, the piece of tissue. We're cutting 4 micron thick cross sections of that piece of tissue. After that, there's some quality control steps, and that piece of tissue is floated on a water bath, and is then transferred onto a glass slide. After that, it then moves on to providing contrast, optical contrast. So it uses chemicals. The basic one, which if you Google a pathology specimen, you will see this pink purple hue, which is the hematoxylin eosin stain, which again provides contrast and highlights different cellular features of that piece of tissue. After that, it then moves on to the cover slip stage and is then looked at under a microscope by a pathologist, or is then further digitized and is then looked at by a pathologist. Those set of steps are performed by this histotechnologist, and that histotechnologist is in very short supply. So about 6 years ago, there was a rapidly dwindling workforce. That workforce at the time was about 52, 53, 54 years old. Today, again, the average age is roughly 58, 59. And COVID accelerated a very real problem with this labor shortage. There are not enough people to process biopsies. And it's a very scary state because we all experience it. In the state of New York, there's roughly 20 million people. There's less than 350 histotechnologists. And it doesn't matter where you go in the country or anywhere in the world for that matter, we have shortages. Some are more acute throughout the United States. But when you go to less industrialized areas, take a rural place in South America or India, you may not have any histotechnological talent. And so it requires automation to advance and process the sheer volume, but then also to provide an avenue into the future of where laboratory medicine and where pathology is going, and provide advanced capabilities, in particular digital pathology and all of the advances that come along with digital pathology. So we are building a sectioning robot that takes that human histotechnologist and automates all of those features and functionalities. And that's a very tall order.
Well, let's if you don't mind, let's dive a little bit into that tall order. Help me understand kind of what's the solution that Clarapath has come along.
So again, that histotechnologist spends a considerable amount of their time every single day, call it 6 hours, 8 hours, 10 hours of their day, cutting these cross sections of tissue, transferring them to a glass slide, doing the quality control steps. They're making decisions about that piece of tissue in real time. And we have an unbelievable workforce that although in short supply, an unbelievable workforce that is very technically talented. Uh, the truth is, mistakes happen. Most of them are overworked, working 2 and 3 different jobs, and mistakes can happen. We want to eliminate that. We want to provide less, more objectivity to a very subjective field. And the best way that I can describe it is there are decisions that are made real time based on practice, but it may not be based on, you know, different tissue types have different properties. Let's say a breast biopsy is different than a colon biopsy. The tissue behaves differently. How long that tissue gets hydrated, how easily it's sectioned. Every one of these pieces of tissue yields has different properties. So we are looking to create the perfect section. We want to have, and I like to think of it like equalizer settings on a stereo. If I'm listening to opera, I will have different mid, bass, treble. If I'm listening to rock and roll, I will have different set of equalizer settings. And it should be no different for a piece of tissue. A skin biopsy is different than a liver biopsy, which is different than a breast biopsy. We should be able to plug those parameters in and have the perfect slide created, and do that in an autonomous fashion. So we're bringing objectivity to a very subjective field. And we're doing that within really the confines of a box. There's roughly 30 different subsystems, if you think of like a car, that are all embedded together and range from mechanically moving things from point A to point B to point C to point D, all the way to optical systems to look at that piece of tissue in real time, and then software systems to be able to make those decisions in real time. So there is a mix of software engineering, mechanical engineering, optical engineering, chemical engineering that all gets packaged together into this box to be able to autonomously process tissue biopsies.
And let's talk a little bit about the company itself. Eric, as you kind of look down your horizon a year, 3 years, 5 years from now, what's your vision for Clarapath?
We are a rapidly growing company, and we want to make sure that every lab has access to talent. And so over the next 12 months, the next 24 months, we are bringing up production within the next 12 months here locally. We have brought advanced manufacturing capabilities here in-house, and we are assembling all of our devices here in the Westchester region. And we will continue to build and grow that capability as we scale. Over the long term, we are looking at fundamentally changing the way laboratory medicine is practiced within the pathology realm. Um, Historically, pieces of equipment have been put into silos. We view pathology, just like radiology and imaging, as a critical linchpin to practicing modern day medicine. And as we advance on sort of that journey, we're going to be bringing automation to the laboratory space, not just in the section star system, but other pieces of equipment that get connected, so that a block of tissue goes in, goes all the way through a set of steps, digital images come out, artificial intelligence and machine learning is helping provide assistive diagnostics. Um, and no human really has to touch that. And then we can start to layer in advanced capabilities within our machine. So over the long run, we are looking at building up automation within the lab and providing advanced diagnostics.
Safe to say you're bringing smart technology to pathology?
Yes, I would definitely say that.
Yeah.
But there are interesting pathologists in pathology is such a critical linchpin to oncology care. Without it, you can't practice oncology, and it determines and dictates treatment pathways and whether a patient actually receives X or Y or Z treatment. So we want to provide more timely diagnosis, more accurate diagnosis, uh, and provide access. Doesn't matter where you are in the world, but telepathology needs to take hold so that we can provide access to anyone and anywhere in the world.
And I recognize that you're really, in so many ways, kind of busting apart physical locations, and at the same time, you do have a physical location. You're in Westchester County, New York. You've talked about doing some manufacturing there. I'm wondering, in the couple of minutes that we have left, if you could talk, Eric, perhaps about your own journey as an entrepreneur. What brings you to Westchester? What brings you to the Hudson Valley? Have there been attributes or connections in the region that have been important to you in the growth of your company?
Absolutely. We have, as I mentioned early on, our business was really founded within Cold Spring Harbor Laboratories and in the Northwell Health System. Over the years, that's grown and morphed into other strategic partners and other health systems that have contributed to the development of the company. Um, we have strategic partners that are in every hospital. I mean, we sit next to Regeneron, New York Medical College, Westchester Medical Center, Phelps Hospital, Northern Westchester Hospital, Montefiore. I mean, the list goes on. White Plains Hospital. Um, they all sit right here, from pharma companies and all the to clinical institutions, and we're unique in that we have the end customer here. We operate a lab here at Clarapath, which is absolutely critical to developing a piece of technology that that will be adopted and fits into the existing workflow. Uh, but then we also have the advanced, I'd say, talent pool, and um, from a robotics standpoint, where we pull people from chemical engineering, mechanical engineering, electrical engineering, software engineering, optical engineering, uh, basically every engineering discipline that you can think of, we pull from our employee base. And so the region, historically, we have quite a bit of pharmaceutical work that's gone on in the New Jersey region, in Connecticut and New York, quite a bit of defense. So great mechanical engineering and optical engineering, and control systems. You start to bring through all of these disciplines and all of these people within the region. Uh, that's what was very attractive to us, is that we could pull from a talent pool that is absolutely critical toward developing a device like this.
Well, Eric Feinstein, thank you for spending some time with us. These conversations always seem to end too abruptly. It's fascinating talking with innovators doing exciting stuff in the life sciences and healthcare. So, Eric Feinstein, CEO of Clarapath, thank you for spending some time with us. For folks who are interested in connecting with Clarapath or learning more about Clarapath and its technologies, you can find more at their website, Clarapath, CLARAPATH.com. Eric Feinstein, again, thanks so much for joining us today.
Thank you.